Hi guys, back again with another favorite muscle, and this is the glute med. We talked a little bit about the glute maximus, right? But the glute med's a little more, the line of the angle of the tissue is different. So the side angle of the glute med is more vertical, whereas the glute max is a little more diagonal, and they actually do different jobs because of that, right? But I've got a couple pictures I want to show you, and I'm hoping it's as simple as just turning my camera around. It's not going to let me, maybe. All right, so I'm going to show you them this way and hope that we can see what I'm talking about. All right, so that's the glute med. And if you can imagine it quite lateral, right? So a sense of the ilium feeling almost parallel to each other. So the ASIS are pointing very forward, and then the glute med is very vertical, right? From your greater trochanter to the whole upper crest of the ilium like that. And kind of works obviously abduction big time, right? There's a little external and a little internal rotation because of its location. And now this other picture I'm going to show you will give you a hint as to what occurs, and you may have clients or you may feel this yourself. When you're standing on one leg, if the glute med of that leg is not strong enough, the hip on the other side will fall, right? So strengthening the glute med of the standing leg will enable the pelvis to stay parallel to the floor, all right? And this has a property of being basically something they call the Trendelenburg gait. So when you see somebody walking and they step fall like that, that's what that's referring to. Okay, so play with it yourself, just sitting upright in a chair and trying to actually imagine you're in charge of your ilium with those muscles, right? And a lot of us are tight enough that when we're actually sitting in a chair, we're kind of collapsed, and then the weight is falling more into the sacrum and the low back. But if you can hold your ilium up and feel the power separately, really, from your spine and your legs, right, then you have a sense of more control in hip extension, hip flexion, and spinal extension, spinal flexion, because they're connected but separate enough. All right, so play with that in jackknife, right, when you're upside down and it's so much more complicated, right, and see if it makes sense. Okay, thanks.